Hi, everybody. I'm Dr. Elizabeth Yurth from Boulder Longevity Institute. I want to introduce you to our new podcast with my friends, Dr. Suzanne Turner and Dr. Erika Schwartz. We have basically been frustrated in medicine for a long time because of the paradigm of medicine that really just addresses disease and really doesn't try to figure out what's wrong with people, try to make people healthy. And so all of us many years ago decided to get into a different type of medicine where we're really working with our patients to try and make them healthy. But over the past 5 years, we had the opportunity to get a little bit deeper into that. And the three of us began to look a little bit harder as to what else is out there. You know, we've been using hormones and we've been using nutrition and we've been using exercise. But we thought, yeah, there's got to be even more. And so we began to get even more leading edge. We started learning about peptides and more recently cellular medicine. And so over the past 5 years, we've become very fast friends. And we've had the opportunity to be involved in a 25 group mastermind of physicians who are on the cutting edge of medicine. And we're learning things that will take another 10, 15 years before they ever get into the mainstream. And we're bringing that to our patients. So we're bringing things that you've never heard of, things that other doctors aren't doing. And we really want to share those with you. And one of the things we found was that there seems to be a lot of men in this field introducing things and talking about it. There's a lot of podcasters who are talking out there, and they're talking to women too, but they're very male focused. And we saw that there was a dearth of females who were out there teaching you guys, the women out there, and men if they want to listen to us, about all the other things that are out there for us. I think that, for instance, when we look at exercise, women are told to exercise very differently. They're not treated the same way. They're not using the androgens that men are. When we look at even peptide therapies that all of us use, there's a difference in how we treat men and women. The literature is all bent to men. And so we are going to take the next 20 minutes here to talk about women. And we hope that you'll tune in regularly and send us your ideas and things you want us to talk about. But I think you're going to find this a really unique experience that does not exist anywhere on the internet right now. So I'm going to let the girls introduce themselves, but myself, I'm Dr. Elizabeth Yurth. I've been in orthopedic practice for many, many years, but began doing more of a functional medicine clinic about 16 years ago and have become so much more enamored with that type of medicine. I still do orthopedic medicine through a regenerative approach, but we treat the whole body at Boulder Longevity Clinic. And so I'm going to let Suzanne and Erika introduce themselves.
Go ahead, Erika.
Why me? Hi, my name is Erika Schwartz. I'm a physician. I've been a physician for over 40 years. I was trained in internal medicine and critical care. And my first job was to run a major trauma center. I live in New York, so it's outside New York that I started my career. And after 5 years of running the trauma center, I went into internal medicine practice and realized very shortly thereafter that what I was doing was really not helping patients. I was waiting for them to get sick, and they kind of never got sick. Or when they got sick, it was too late. And I realized that life is a continuum of health with interruptions when you get sick. And I wanted to make the continuum of health longer and longer, as long as possible. So conventional medicine did not lend itself to that kind of thinking. And about 15 years into practicing medicine, I realized that there were better ways to do it. It was pretty early because it was in the early 90s that this happened. And my first encounter to integrative medicine, looking at the patient as a 360 degree with everything that affects everything else: diet, exercise, lifestyle, stress management, sleep, jobs, COVID, everything that happens affects everything else in our bodies. So 15 years in, I realized that it was time to put the pieces together and realize that we are only one person, and brain, soul, body, we're connected. And my first part of this learning experience, the journey, was really hormones. And I kind of landed the right place, the right time, because I was working with what is now known as bioidentical hormones, But at the time, they were called natural hormones because they're identical to what your body makes. And when you're young and healthy and you're full of hormones, you feel great. When you get older and your hormones start leaving you, you start getting chronic illnesses. And working with hormones taught me very quickly that I can actually work towards preventing the chronic illnesses. And so that's where I started my career in what I call prevention. Some people call it functional medicine, alternative medicine, integrative medicine, cellular medicine now. Well, anyway, a few years, within 15 years, 20 years of that beginning, and I was by now into bioidentical hormones, but also diet, exercise, lifestyle, supplements. 5 years ago, as Betsy said, I came across peptides and now cellular medicine. And that actually put a completely different perspective on what I do with my patients and how I can help them. My goal in life is to help my patients lead the best life they can every day of their lives. So I serve my patients, and I will now serve you together with these remarkable two women who I adore.
Thanks, Betsy. My name is Suzanne Turner, and I have been in family medicine in Atlanta for 15 years now. And it's been a great experience. I started out just seeing probably 30 patients a day and seeing 7 minutes at a time. And doing that work, you just realize you're really not doing anyone a service. You don't ever really find out what's wrong with them. They come in the door and they say they have high blood pressure, and you say, okay, here's your blood pressure medicine. And they come back and they say, this blood pressure medicine didn't work. And you go, okay, let's try another one. Instead of saying, why does this patient have high blood pressure? And even today, like training my nurse practitioners and PAs who work in my office, it's a constant battle to wean them off of that typical allopathic training from disease and drug to why does this patient have this presentation? And it's not that they have high blood pressure, it's that this is a sign of something happening at the cellular level that's making them have disease. And much like Betsy and Erika, I came into this through bioidentical hormones, and that was the answer and is the answer for many people. However, at some point, that bioidentical hormone didn't become, there were patients who didn't respond to the way I would have expected them to. And my practice now is full of those patients. So we had to find a different way. And the three of us met at a conference several years ago and have continued to be in contact and in training and in teaching together in this way of thinking about medicine and thinking about patients, in the goal of making patients better at whatever stage of wellness they are, both from healthy patients, but also from patients with Lyme disease, patients with mold exposure, patients who have systemic arthritis from whatever autoimmune process. All of these patients can improve in their symptoms if properly treated. And so that's what all of our goals are. And I think that's why we're here, trying to help you all see where we come from in our world and our perspective of treating patients.
And these two are being really modest because Erika is actually a really very well-published author. She takes care of movie stars. She's and Suzanne is one of the physicians in the highest demand across the U.S. that I know. So these two are being really quite modest about their practices. Erika's fame, if you look her up, goes well beyond her immediate patient population. So I'm honored to be able to be a part of this group. I think one of our goals is to teach you guys. We realize that not all of you can come see us, and we really want you guys to have the education that you can take care of yourselves and empower you to have health in your own hands, because your physician's not going to. The medicine we do, there's really only a handful of physicians who are learning, even within the functional medicine doctor population, only a handful of physicians that are learning the things that we're learning, and there's no way to get it to all the physicians. The physicians don't want to know it, and it's hard to learn. We've gone back and had to relearn cellular medicine from the very basic Krebs cycle that we all learned in basic chemistry. So I think that we hope that over the course of these podcasts, these programs, that you guys will learn to actually take control, what you can actually do on your own to take control of your health. And then, we always will try to see patients, but we all three of us have busy practices. And if we can't get you in, we hope that we empower you to be able to take care of yourself. I think today and over this course of our programs, we're going to bring you tons of really cool information. Those people who want to learn about bodybuilding, those people who want to learn about arthritis, we're going to bring all that information to you. But we want to start with a topic that's so near and dear to us. And I'm going to let Erika sort of branch it off. But that's really hormones and cancer, because the biggest thing I get every time I put a woman on hormones is, oh, well, my doctor told me these cause cancer, so I don't want them. And even if I get them on them, their doctor takes them off of them because they're told these cause cancer. So I'm going to let Erika shoot off, and then Suzanne and I will sort of chime in because she's been doing this for a long time and has a lot of background in this.
I've been doing it for a real long time, and I never would have thought that I was going to do it because I totally stumbled onto it. And it's a fun story because at the age of 46, I was already working with hormones, but I was like, I had written my first book, which was called Natural Energy, which was about mitochondria, which are, those little organelles in the body, in the cell, which now we are learning more and more about. And this is where our cellular medicine comes from. And I was writing about L-carnitine and CoQ10, which are an enzyme and an amino acid that everybody now knows, but at the time, nobody knew anything about it. This was 1999. And I thought that was really pretty good because I figured out how to give people energy. Anyway, and then I got into hormones, and I was working with hormones, and I actually got married, and I was on my way to my honeymoon to Rome, to Italy, and I get a call from this woman from Vogue magazine that was actually writing an article about what I was doing. And she says, I think you should stay in New York because, this big study, the Women's Health Initiative, is actually going to be stopped, and you're gonna be asked to talk about it. So I looked at my husband and I said, I don't think we're stopping, let's keep on going. So we went, and I spent the whole vacation on the phone at 3:00 in the morning with media outlets in the States. So this is where it all started. Before 2002, hormones were okay. Nobody cared because they worked, they didn't work. Women were on birth control pills. They thought that birth control pills and hormone HRT that was given after menopause were the same. It was very simple, 2 pages in any OBGYN manual on women's health, basically. Nobody ever talked about hormones. But then after the Women's Health Initiative, which was a big endeavor sponsored by Yurth Pharmaceutical together with the government, the US government, they figured out that Premarin, which was the main hormone replacement therapy that was being used for the 50 years before, since the 1950s, was going to really be the fountain of youth. And that together with Provera, which was the drug that was Prempro at the time, or Provera or Premarin, which was given only to protect the lining of the uterus that may be getting thicker if you take Premarin, the two together were going to show the world that women needed Premarin and Provera to weather the problems of menopause and protect them from heart disease, etc. Well, unfortunately, that's not how it turned out. There was in the study, they never looked at anything except for Premarin and Provera, which are both synthetic drugs, which are lookalikes of hormones, but they're not like our hormones. It's like putting a round peg into a square hole. So they kind of fit, but they don't really fit. Bioidentical hormones that we know today, natural hormones that we knew yesterday, are the ones that are identical molecularly. They look exactly the way as our own hormones look. So those were the hormones that were not part of the study. And the reason they weren't part of the study was because were not made by, in any FDA approved formulations at the time. Now they're made Everything except for testosterone is made. Estradiol, progesterone, they're all in FDA-approved preparations. But the reason they weren't at the time was because nobody thought about the difference between something that looks like what your body makes versus something that doesn't look like what your body makes. And we thought that everything would be the same. The effects were the same. It was called that there was a class effect. So all estrogens behave the same, or progestogens behave the same, but that's not true. So anyway, as a result of the study that went bust in April of 2002, the Women's Health Initiative, it went bust because it turns out, and that was wrong too, because it wasn't correctly evaluated at the time. It turned out that women who were on Premarin and Provera had a higher incidence of strokes, heart attacks, and cancers. And so they stopped the study. It was an 8-year study that was stopped 5 years early because of these horrible things. As it turns out that it took 12 years to evaluate the results, to do the research and statistical data analysis on the study, it turns out that that wasn't true either. That Provera is not a good drug, which we know because it causes blood clots and it may kill you. But Premarin wasn't doing very much of anything. But the outcome was that the medical profession got really scared, and especially because of the government was involved in it. So all the medical societies, as the American College of Obstetrics and Gynecology, the American Endocrine Society, which are really all pharma sponsored, turns out that they immediately told the doctors, you have to stop giving hormones. So 7 million women were taken off hormones overnight. It may not be the hormones that we work with, that we like, but the truth is that those hormones were doing something to keep them from getting sick, from getting old, from losing their minds, from getting Alzheimer's. You know, it was doing something, but the doctors never learned anything. And fast forward 11 years later, I was invited by the North American Menopause Society to give a talk about the difference between compounded versus FDA-approved hormones. And the weirdest thing is that 5,000 doctors in the audience had no idea that compounding is okay. That compounding actually, you're compounding the same thing that you have FDA-approved, and that these drugs not only don't cause cancer, they protect women from cancer. And the scientific data, as you all know, supports it to the T. I have patients that have been on hormones for over 20 years, myself included. I don't have any cancer. My patients don't have cancer. People who don't take hormones get cancer because as you lose your hormones, your body is unable to fight off disease. And if you look at 20-year-olds, what's the incidence of breast cancer in 20-year-olds? So I don't want to continue because I want you guys to talk about it, but it is one of the saddest things in my life that I still spent 20 years later, because it's going to be 19 years after the Women's Health Initiative, and I still spend my time explaining to doctors and to women, and doctors will get on the phone with me now. They used to not get on the phone with me before, but now they get on the phone with me and say, can you send me some literature? And I do send them literature, but that's not the point. We have wasted women's lives. We have wasted the time. And if we don't start demanding that women go on bioidentical hormones, we're going to waste another generation of women. And, you know, I have a lot of young women in their 30s and 40s, and everybody just takes the hormones and they don't care anymore. And they abandon their OBGYNs if anybody says anything against them. But they still do. They still do because they don't have the information. In 2011, I was at the International Menopause Society in Rome, and we were taught, all the doctors there, we were given all the information, all the data necessary to see that there is no class effect, meaning that different preparations of hormones behave differently in the human body. And to this day, in the United States, doctors have no idea about that. They think that birth control pills, HRT like Premarin, or bioidentical hormones are all the same. And they're not. They're not. So you need a doctor who understands that, and a doctor who respects you and will help you find the right hormones that work for you. because it'll change your life for the better. I'll leave you. That's it. I'm standing back.
So I'm going to just speak really quickly from the orthopedic perspective, because I see so many women come in their 70s with a vertebral compression fracture or a pelvic fracture, and no one's ever checked a bone density on, but when you check it, they've lost 35, 40% of their bone. And the reason is because you absolutely have to have hormones for bone, and not just estrogen. Estrogen gets all the credit, but progesterone is necessary, as are androgens like testosterone. So you have to start replacing these hormones. Many more women die of osteoporotic fractures. My mother just died after falling and having a pelvic fracture. And many more women die of osteoporotic fractures than die of breast cancer. And yet we're terrified of breast cancer, and the doctors aren't even looking at osteoporosis in these women. It's such a mistreatment. You know, we have this fear that's based on a study that was all retracted by the authors themselves. I mean, the authors themselves, and it never got published, came back and said, oh, wait, our data was interpreted wrong. This was wrong. And yet that never came back and got published. So we still go back to a study that was incorrectly done, incorrectly interpreted, even by the authors themselves, never changed anybody's opinions of something that was in 2002. It's absolutely ridiculous, and we're hurting a slew of women. None of us want dementia, and you will absolutely get dementia if you're not doing hormones. Almost absolutely. Maybe you've got wonderful genetics and you won't, but for the most part, you cannot maintain brain health. You cannot maintain cardiovascular health. You cannot maintain bone health. You're going to look bad. Your hair is going to be bad. Your skin's going to be bad. You can't build muscle. None of us want that, and yet every patient is afraid of cancer, and an equal number of women who are on hormones versus not. And as Eric said, probably less so. Women on hormones are going to end up with cancer than women who are not on hormones. So I know, Suzanne, you deal with a lot of women too.
Right. The concern for me with this, although all of what you're saying is valuable and is relevant to our practice, the specific concern where a majority of my patients are these inflammatory disease patients. And so we know that estrogen deficiency specifically is involved in, the body creates this sort of a bomb inside your cells called an inflammasome. And one of the triggers for that bomb is estrogen deficiency. And so when the body detects that estrogen deficiency, it creates a trigger to make that bomb go off. And now things that are supposed to be hidden from your immune system are visible to the immune system. And you begin to create things like double-stranded DNA antibodies, things like RNA antibodies. And so your body begins to attack itself. And this is one of the consequences of having estrogen deficiency. And it's one of the things that many of our women are dealing with, and men are dealing with now, having had this big study come out that was supported by the media so much. And now it has been disputed and found to be incorrect. So now we're having to reconvince patients, and I spend time convincing patients that it would be really beneficial, both for heart disease risk and for autoimmune development of autoimmune diseases. And then, as Betsy was mentioning, neurodegenerative disease, which is another thing that we see a lot in our practice, that inflammatory process that occurs in the brain is very much affected by your hormone status. And so this can occur at many ages, not just elderly patients. And so we try to get patients started on hormones as soon as we can. That seems appropriate as soon as you begin to lose them. Patients don't realize that they may begin losing hormones as early as age 25 or 35. Somewhere in that range that we begin to see those hormone levels drop, and not just familiar hormones like estrogen, progesterone, testosterone, but also things like growth hormone, thyroid hormone. All of these begin to decline as we age. And so even early signs. So I'll see women who come in on birth control pills who have terrible depression symptoms. And I say to them, this is probably because you're estrogen deficient. And they say, but I'm taking hormones. And I say, but you're not really. And we draw their blood and they really don't have any hormone. Their body can take what you've given them with the synthetic hormones and can do a few things with it, but it doesn't do all the natural, beautiful things that estradiol was designed to do, that progesterone was designed to do. And progestins are a completely different molecule that does completely different things in the body. It's wonderful for protecting you from developing uterine cancer if you're taking hormones, but it is not the answer. And in fact, we really prefer for you to be using natural progesterone. There's so many benefits. And we'll use progesterone in our elderly men who are having dementia, aggressive behaviors with their dementia. It's it's very calming. It binds to GABA receptors in the brain, which is GABA receptors are the ones that Xanax and alcohol bind to. And so you get this lovely calming effect, but a natural effect from the allopregnanolone that's converted with progesterone is lovely. And so patients who are experiencing anxiety as they get into their 40s and 50s, often this is a progesterone deficiency. And these are easy things we can look for and treat.
It's really interesting that we're living in a time when, people think that prevention is really having these tests done on a yearly basis, the mammogram, the bone density, and we do and what do we do with the results? If you in the mammogram, I don't even want to go there because you do biopsies that you shouldn't be touching the patient. You should not be doing half of the stuff we do. But bone density, what Betsy was saying, is really important because they're doing bone density every year, and they say you have osteopenia or osteoporosis, the beginning of it, and we're going to give you a shot once a month, and it's like, no, we're going to give you two things. We're going to give you hormones, and we're going to tell you to exercise. So this is what happens. Our patients stop doing bone density because what are you going to do the bone density for? If you're exercising and taking your hormones, you're going to do fine. You're going to do really well. So I think that that's so important that, everybody's so unaware and the doctors are not helpful. So it kind of becomes important for each one of us to live in our own body and understand and take responsibility for our own outcomes.
Absolutely. Thank you.
Yeah, so thanks, guys. So we're going to start doing this regular as a monthly series. Hope to get it out to everybody so you guys start learning this. Share it with your friends. We're working on trying to make sure that you guys have access to the information that we do. And again, maybe your doctors will get this eventually, but the things that we're working with will probably be another 15, 20 years before they get into mainstream medicine. We are trying to stay so leading edge, and again, there's only about a handful, 25 or so docs who are really learning this kind of medicine and able to bring it to you. We have pharmacists across the country that we work with to make us special substances that we learn about. We're trying to understand disease from a whole new level, and we're going to share it with you guys. So if you have any questions for us, please send them off to us. If there's things you want us to discuss, please send them off to us. But welcome to our new series, Beyond Bro Talk, and top women docs talk about the latest in health. So we're going to bring this out to the mainstream. Thanks, you guys. We'll see you soon.
Thanks,
Bye.
Betsy.